This is Arjo's MaxiMove. It's a dependent device. It's designed for a patient that weighs no more than 504 pounds. This patient has non-weight bearing and can tolerate a semi-reclined position. It is a mechanical device. It has an on and off or an engage disengage button. Red disengages the device, green engages it. It is powered by a battery. Every MaxiMove comes with 2 batteries. One will be in the unit ready to charge. One will be in the unit ready to go. The other one will be on the unit somewhere charging, ready to be replaced. Typically, you rotate batteries every 12 hours. For example, at 7 a.m. and 7 p.m. The MaxiMove has a remote with buttons to control the device. These buttons are also on the mast of the MaxiMove. The buttons are pretty straightforward. When the device first is turned on, it is in a hibernation mode. So when you push a button, it'll take about 5 or 7 seconds for the device to wake up. Once it wakes up, you can then use the buttons. The up arrow raises the mast. The down arrow lowers the mast. On the bottom of the remote are 2 buttons that control the legs. One shows the legs opening, and the legs open in a staggered fashion. So you can open and close the legs. In addition, there are 2 buttons that show somebody in a semi-reclined and a fully inclined position. If you look at the spreader bar, it's set up right now for someone to be in a semi-reclined position. The shoulders would be attached here, the legs over here. If I push the recline button, it will move the person to a fully reclined or supine position. If I push the incline button, it'll bring that person up to fully inclined position. And of course, you can choose to stop anywhere within the range of that motion. On the monitor is a scale. If you push the button with a little weight symbol on it, it will zero out the scale. Later on in this video, I will show you how to work the scale. The MaxiMove is equipped with brakes, 2 of them. To engage them, you just press down, and they are engaged. To disengage them, you just flip them up, and they are now disengaged. When working with the MaxiMove in a functional situation, you will rarely be engaging the brakes because you'll be moving the MaxiMove to make subtle adjustments. The brakes are typically used when the MaxiMove is parked or if there's a specific therapeutic intervention you're wanting to perform and the brakes are needed. If for some reason the battery dies, you cannot get the second battery, there's some kind of failure, and you have the patient raised in it and you need to get them down, you can use the emergency lower. You simply flip the red lever, pull out the pin, and begin to just simply crank the person down. And you'll see it slowly will bring itself down. I strongly recommend, if you're going to lower somebody this way, get them over a bed, raise the bed to the highest point, and then begin to lower the person. It will save you a lot of time and effort. Then be sure to put the pin back in, lower the lever, and you're good to go. On the MaxiMove, it has some indicators. It shows you the weight capacity of 500 pounds. It shows you sizing for the slings. It shows you how low this spreader bar can go into the water. If your MaxiMove has a sticker on the mast, it is equipped with a scale. If you do not see this weight or bell-shaped symbol, your MaxiMove does not have a scale. The MaxiMove comes with reusable and disposable slings. These are the disposable slings. Both the disposable and reusable slings are marked the same way. If you look at the border colors, that indicates the size. Red is small, yellow medium, green large, purple double large, blue extra large. If you look at the slings, it has a black symbol on it. That indicates do not launder. If this sling becomes significantly wet or goes to the laundry, it will dissolve and you will see a do not use indicator. If that is the case, you need to dispose of the sling and get the patient a new one. If you look at a sling and you open it up, there are some clear parts of the sling. This rounded part is the head of the sling. You'll see that symbol we talked about earlier, and there are also stays or head supports in the sling. The person's head sits between the two head supports in the sling. The shoulders attach at the top two portions of the clip, the legs at the bottom. On the bottom of the sling, this curved portion, this is what's going to sit 1 to 2 inches below the patient's tailbone. If you notice on the medium sling, there are 3 darts. The middle dart, or dart number 2, will line up with the tailbone when you're placing the sling. With the large, extra large, or double L sling, there will be 4 darts. 1, 2, 3, 4. You're aiming to place the person's tailbone between darts number 2 and 3. The first thing we have to do is size our patient for the appropriate sling. The way you do that is you're going to take your MaxiMove sling and fold it in half. What we're going to do inside the sling is a set of stays. You'll be able to feel them. If you go to the base of the stay and to the back end of the sling, I'm going to put it against his body. The base of the stay at the shoulder, and then I bring this down to see where the base of the sling will be. I want to be several inches below his tailbone. That will show a good fit. This purple or LL sling is the appropriate size for him. If I take a medium sling and I put it up against him, same exact way, you'll see that we do not have appropriate fit. The bottom of the sling doesn't come anywhere near his tailbone. We're now going to apply the sling to Craig. What I'm going to do is I'm going to take the sling and hold it upside down. So I'm going to be leading through for the base. If you notice on this sling, it has 4 darts. 1, 2, 3, 4. I'm aiming to be getting his tailbone between darts 2 and 3. I'm going to ask my patient to lean forward, or I'm going to assist him to lean forward. I now take the sling, open it up, place it behind him, and now I'm going to tuck it with darts 2 and 3 placed at his tailbone, making sure that's coming under his bottom. I'm going to scoot it under there. Open up the sling so he's there. He leans back. I bring up the sling like so. This is going to come around like that, and we're good. I'm going to take the legs. I'm going to now kind of scoot this down underneath him. I'm going to bring this under his leg like so and give it a pull. Same thing over here, and give this a pull. We are now getting ready to lift him in the device. So now I'm going to get Craig into the MaxiMove. Of course, we've had a conversation, so he knows what's getting ready to happen. We've done excellent bedside manner, and we're ready to get up, right? Correct. Great. So what I'm going to do now is I need to make sure the spreader bar is matching his position. So if we can see right now, it's kind of in a semi-reclined position. I want to get the shoulder attachments lined up with him, so I'm going to push the incline button, which will bring this into a more of an inclined position and setting him up for sitting. Now I have the shoulders aligned and the legs aligned. But now as I turn the device towards him, if I bring this over to him, I'm going to lower it down on him. That could frighten my patient. What I want to do is set myself up and match his position. So now I'm set up for his shoulders and his legs and have some maneuverability as needed. I'm going to open the legs of the MaxiMove to accommodate the chair, and I'm going to bring it in. As I come in, I can attach either the shoulder or the legs first. It just depends what's closer. At this point, I'm going to choose the legs. So I have 2 options. The typical, most straightforward method is to put the right clip on the right lug and the left clip on the left lug. If I have a patient that has very restless legs or legs that move all over the place, I could cross them, like so. But the most traditional method is to not cross them. So from here, I can see that I have to do a little bit of work to get it up, so I just need to make a couple of adjustments. And I can see that I'm right there and I'm able to get him there. I'm going to do the same thing from the other side. And if my patient can move, might as well encourage him to do so. Craig, can you lean forward a little bit? Get that there. So I'm having a little bit of struggle there. I just need to bring this down. In this case, I'm going to tilt it towards him. And I'm on. So again, I'm able to remove all of the challenges there. I'm now going to just double check to make sure the lug is sitting at the top of the clip. Everything looks good. You can hug yourself or put your hands over here, whichever you feel more comfortable with. And I'm now going to raise him. As he comes up, again, I'm just encouraging him, letting him know what's going to happen, and we begin to raise. The device will move to accommodate itself to match his position. Now, when we raise him, often people get concerned that there are wrinkles and such. You don't want to start adjusting the sling until his bottom clears the chair or the bed. I'm going to take the top of the sling and give it a slight little pull, and you can see he already settled into it and probably feels a little more comfortable. In addition, I'm going to check at the legs to make sure that there's no roping. Can you lift up your leg for me, Will? So there, like so. And here, okay, very simple adaptations. We're now going to move him to bed. When applying a sling, it's really important to make sure you have it attached correctly. In this situation, I am going to raise him in an incorrect fashion. As you can see, as I've placed the sling, the base of the sling is not below his tailbone. So I can actually see part of his bottom. As I continue to apply this and put it under his leg and move it forward, what's going to happen when I raise him is he's going to slide. This can create a couple of issues. One, it's going to cause discomfort for the patient. It's also going to cause him to slide further into the sling, which is not good. In addition to that, it's going to increase the angle of flexion of his hip. So as you may be able to see, you can see the bottom of his bottom in the scrub. Again, this really should be much further below his tailbone. So as we raise him, I want you to pay attention to what's going to happen, as this is what happens with a poor sling application. Ready? We're going to come up in the air. As he comes up, you'll notice we're not by his tailbone, and he's already beginning to slide further. If you were to lift his legs a little bit, you can already start to see how he's going to slide down further. And we are now way above his tailbone, creating pressure. We've also changed the angle of hip flexion, so if there was a total hip precaution, that could also be a problem. So this is very important when you're applying the sling to make sure that the leg and tailbone portion is covering the patient completely. We're now going to take Craig to bed. So now I'm going to simply back the device up. Once I'm past the chair that he's sitting on, I'm going to close the legs. I can use the buttons on the mast or on the remote. I'm closing the legs because, as I said before, it's always easier to move a piece of equipment with the legs closed and there's no risk of tipping. As I come to the bed, there are going to be a series of adjustments that I need to make. First of all, I need to bring him up higher so we can clear the bed. I'm going to turn him to match the bed's position, and as I come in and bring him in, I'm going to continue to make some slight adjustments. Perhaps the patient can move his legs, and I'll ask him to raise his legs, or I may need to raise the device higher. I'm looking to get him into a position so I don't need to boost him once I lie him down. I now have him in that position. I want to match his position with the bed. I could have the head of the bed down, and then I would just have him totally flat. That may be the most clinically appropriate way to place him in bed. For most patients, it's going to be more comfortable if the bed is slightly inclined and the patient is in a semi-reclined position. So now I'm going to bring him back down. So we're going to lower you into bed. You ready?
Yes.
Here we go. As he comes down, I'm paying attention to the spreader bar. I want to make sure that I'm not pressing down on him. I might even tell him that you might feel the spreader bar touch you. That's totally fine. I'm really paying attention to make sure that I'm not putting any pressure down. If you recall from what I showed at the beginning, there is an automatic cutoff if the spreader bar feels any kind of pressure. So from here now, I'm going to just make some adjustments so I can make this easier for me to remove. This pops off like so, that pops off like so. If you can see over here, again, I might have a little bit too much work to do, so I'm just going to now make some adjustments. And this will pop off over here, and this one over here, like so. Now that he's out, I'm going to ask him to put his hands across his chest. I'm going to raise the device above him and remove the MaxiMove from him. I want to make sure I have adequate clearance so I don't touch him with the spreader bar. I'm now going to simply take the legs and pull those back this way, pull those back this way. If my patient can sit forward, I'll just take it and pull it out. If he cannot, I will simply log roll my patient to the right and left. I would remove it like I would a sheet. We're now going to take Craig, our patient, out of bed and put him into the chair. So what I first need to do is apply the sling to him, and the simplest way to do it is with a basic log roll maneuver. So as I uncover him, I'm now going to lower the head of the bed because it'll be easier for him, assuming he can tolerate a supine position. So what we're going to do now is apply this thing while he's lying down. We're going to use a basic log roll technique. If my patient can assist, that's fantastic. If he can't, I'll have to do a little more work. If my patient can bend his knee, or I can facilitate that bent knee and have him reach to the side, I will get him totally turned. I'll then take my sling, which is folded in half, and it can go either way. I'm going to now apply, making sure the bottom is about 2 inches below his coccyx. The top of the sling is going over his shoulder. This part gets tucked underneath. I want to make sure I'm taking the clips and putting him underneath them so he does not feel them when he rolls. He will now roll back towards me. I will now raise the side rails. Or if I have a second person, they'll be working with him from the other side. I'm going to go to the other side of the bed. We're now going to reverse the process. He bends this knee. He reaches over to the side. I come under here and grab my sling. I bring this around as he rolls back to his side, and I begin to place. I'm now going to attach Craig's sling to the MaxiMove. The first thing I'm going to do is bring the device in and over him. As you can tell from the position of the spreader bar, it's no longer matching his position. Since he's supine, I need to get my MaxiMove spreader bar to match that position. So I'm simply going to push the button that shows recline and have it match his position. I'm now going to bring the spreader bar down. As it's coming down again, I want to pay attention to where it is so it doesn't press down on him. As it comes down, if it hits a force, it'll cut out and it will no longer go down. The way to reverse that is simply raise the spreader bar, and then you can continue down on your journey. I'm going to have you cross your arms. Stop like that. So now I have a couple of options as to where I want to attach first. So at this point, since I'm standing by his shoulders, I'm just going to move the device a little closer to his shoulders, bring this up here, and that attaches. If I have a second person, they can assist. As you can tell on this side, it's going to take a little bit of work. So now what I'm simply going to do is push the recline button on the remote to bring it down. Or I can ask my patient to lean forward. It comes on just like so. Now I need to come over to the legs. I'm going to reverse and bring the leg attachment lower to my patient. Come around and make these attachments. 1, 2. He's now in the sling. So again, people want to immediately start to make adjustments. Always wait till the patient is raised in the air. It'll make it a lot easier because you're taking advantage of gravity. We're getting ready to raise you. So as he's coming up, I'm in contact with my patient, and we're going to bring him up. Once his bottom clears, I can now make adjustments. Again, coming to the head of the sling, I can give this a pull up to make some adjustments here. If I look at his legs, I want to check to make sure that there isn't any kind of roping. So if he lifts up his legs, I can make some adjustments there and make some adjustments there, or I would lift up his leg. He's now in the device very nicely. We're now going to bring him to the chair. We're now going to take the MaxiMove with Craig and get him seated into the chair. Are you ready?
Yes.
Here we go. So I'm simply going to back the device up, and if you notice, the legs are still closed because it makes it much easier to move the device. I'm now going to make a few adjustments again and prepared to go into the chair. The first thing I need to do is make sure the legs of my chair are open to accommodate the width of the chair. So I'm going to push the leg opening button. I'm now going to begin to incline him. I'm wanting to set him up so I have clearance to turn him. So now I'm going to turn him and have him come around like so. If, for example, this leg could not be turned around, so if it was out, I could just make adjustments with the MaxiMove and sit him down in another manner. I'm now going to bring him over the chair. As we can tell by the chair's position, he would slide down if I lowered him here. So now I need to incline him to a more seated position. So I'm pushing the incline seat button. As I bring him to a seated position, his weight is going to begin to shift, and he might feel some pressure at the bottom of his hamstrings. So I'm going to get him to an inclined position in a set of stages. So now I have him a little more inclined. I'm now going to begin to lower him to the chair. Once he is about 2 to 5 inches from the bottom of the chair, I'm going to finish and incline him the rest of the way. You can hold on to the bar here if you'd like. Now lower him the rest of the way. As you can see, the MaxiMove accommodates for his position as we have not done the locks of the brakes. As you can tell right now, he's sitting upright correctly in a chair. So often we will put a patient in a chair with a dependent lift, and they wind up on an angle and they immediately begin to slide down. I'm able to get him fitted appropriately almost perfectly. So now at this point, I'm just going to undo my straps, make some more adjustments here. So reducing the amount of strain I have to put forth to get him out. He's now disconnected from the MaxiMove. I'm now going to move the device away. I can even ask him to push the spreader bar away with me or not, so I know he knows where the device is as well. It comes around. And now I'm able to remove the sling. You have a couple of options. Some folks, due to contractures, patient size, you may leave the sling underneath the person. If you choose to leave the sling underneath the person, you need to make sure you're checking the position of the sling to make sure it's not rolling into a position that it might cause a risk for a pressure injury due to a wrinkle. But because it's not difficult to apply and remove the sling, it's often recommended that you remove it once the patient reaches his destination. So at this point, I'm going to have him lift up his leg, and I'm just going to pull this past his hip. Same thing on this side. At this point, I'm going to have my patient lean forward if he can. If he cannot, it's still, since this is removed and it's not under his hip anymore, I can just pull it out with ease. I have him seated. Now I can give him his call light, turn on the TV, take care of him, but we now have him seated. So unfortunately, our patient has taken a spill and has fallen to the floor. The first thing we're going to do is we're going to do an assessment. After we determine that the patient is medically stable, we will then proceed to apply the sling. We're going to do 2 ways to put on the sling. First, while he's lying down on the ground, and then another time because sometimes we find our patients sitting up. So we will now begin. So our patient is okay. Mary is preparing our patient to roll to his side. She's then going to apply the sling. As you can tell, she's applying it first at the shoulder to make sure we have a good fit. Very similar to how we did this while he was in his chair and in bed. We'll then apply the leg across the leg, making sure that the bottom of the sling is a few inches below his tailbone. And again, making sure that his tailbone is sitting between the 2 darts, typically dart number 3 and number 4. Once that's set, we'll prepare to roll him to his side. We will make sure he does not roll over on the clip. And we roll him to his side. He'll continue to roll. I will then retrieve the other side. We'll bring this up onto him and then have him come back to his back. We will now bring the MaxiMove over to pick him up, but sometimes we find our patient who fell and he's actually sitting up. So I'm going to have you sit up. Let's just remove this out from under you. So in this case, we simply put the MaxiMove on as if it were a jacket, making sure that the bottom is tucked about 1 inch or 2 below his tailbone. We're now going to lean him back. The slings come under his legs. And since I have a second person here, Mary can handle the straps. So we're now going to attach the MaxiMove to the sling. Mary's going to manage the sling and also assist guiding the MaxiMove underneath our patient. The first thing we're going to do is open the legs as wide as possible. The best way to position the MaxiMove is on an angle towards the side. You're going to take the one leg that's out and come in between the patient's legs. My partner's watching to make sure we're coming in, and I'm looking to aim to get his bottom at the base. So think bottom to base. My patient might be worried about his head and this leg, so I need to be monitoring that and letting him know that the leg is coming close to him, but everything's under control. So I'm bringing this in, and the leg is, I have it, you're not going to get hit by the device. I'm lining this up to make it as simple as possible. We're now going to position the spreader bar to match his lying down position. And I'm now going to lower the spreader bar. As it's coming down, my partner is making sure that everything is appropriate and paying attention that it doesn't come too low and put any pressure on my patient. So at this point, we can see whatever makes the most sense. In this case, we'll go with his shoulders and just make a quick adjustment here. Sometimes I can ask my patient to lean forward. Can you lean forward a little bit? And he makes it a lot easier for me. Or I might need to adjust the spreader bar further. Yep. So now I'm going to make some more adjustments. And now we're going to reverse the position. And now I'm going to bring this. I'll have my patient move his legs a little more forward if he can. We have that one there, and then we do the second one here. So we're now going to raise him just like we did from the bed. As he comes up, again, often we want to make adjustments to the sling, but we're not going to make any adjustments until his butt starts to clear the floor. Once his butt is clear, I can now make an adjustment at the head. I can check to see if the legs are roping. He's looking really good on that. I'm now going to just raise him up, and we're going to get him back into bed. Okay. Closing the legs because it's going to be easier this way. Mary's adjusting the bed and increasing the head of the bed for more additional comfort. Now we're going to bring him in to bed, just as we did before. Once I have him positioned, I'll begin to lower. Note, I want to pay attention to where he is in the position of bed. If I have him too low, that'd be the time to correct and reposition him so I don't have to do that while he's actually lying down. Once he comes down, we're monitoring the spreader bar. Then we will now begin to disconnect it. We will raise the spreader bar above him. Once I have clearance, I'll back it off and away. We will now remove the sling. And shimmy it up.
Ready?
Yep. Make sure our patient's comfortable, and we've now gotten him back to bed.